Thanks, everyone. I'm the CEO and founder of Cohesys, and what we do at Cohesys is we come up with new solutions for fracture fixation. So fracture fixation in orthopedic devices is a huge market, but it's very complex and time-consuming. And I'll show you a bit what I mean about that. So this device in the top left is a tray of plates and screws. And in a typical procedure, like in the face, there may be 3 of these trays used. So you can see there's lots of individual pieces. And the standard of care in this space is titanium plates and screws. So they're permanently implanted. Complication rates that require reoperation happen in between 5 and 40% of these procedures. So it's a second procedure to go in years or sometimes even decades later and remove this permanent hardware that's been implanted. It's a very steep learning curve, and these reoperations and the procedural time leads to a lot of the costs associated with it. What Cohesys has made is a product called BoneTape that we're now clinical phase with. And the way that BoneTape works is instead of having multiple pieces that require drilling into the bone and fixation with numerous screws, we anchor directly to the surface of bone with BoneTape, and our device is resorbable. So after about a year, it dissolves and is no longer in the body. So that leads to a lot of advantages. One is there aren't these huge instrument kits required, making the procedures much faster and easier. And the other advantage is we don't deal with the complication rates that happen from this permanently implanted hardware that can migrate or become loose or irritate patients over time. So BoneTape can be a lot faster when you're implanting it, especially in the highest value procedures like comminuted fractures, where little fragments of bone are very hard to align and fixate with plates and screws. And a lot of the advantages that we have for this is because of the speed, because of the lack of pre-treatment required, and because it's resorbable and doesn't stick around in the body longer than it's needed to. So the market for this is very large. We're initially targeting the craniomaxillofacial market, so the face and the head, but we're moving on to trauma and a lot of other areas. And some other things that we've been able to do with BoneTape, because it's resorbable, we can deliver drugs with it. So we have IP now on delivery of both antibiotics and orthobiologics from BoneTape in a controlled release over a tunable number of weeks to months. So very, very exciting. We just started a great partnership with the US Navy, and we're looking at FDA clearance early next year, and would love to speak to anyone interested in learning more. Thank you very much.
Great job, Mike.